Hi, in this video we'd like to continue on our PCOS series discussing why certain symptoms arise, why are they so dominant, and also the treatment that we offer here at Antai Hospital. So today's topic will be focusing on the increased sex drive or sexual desire amongst PCOS patients. Now, why is this happening? Now, an increased sexual desire amongst women is most likely caused by an imbalance, disruption, disturbances in your internal hormone balance. And the main hormone involved in sex drive is testosterone, specifically free testosterone. And the difference between PCOS patients and normal healthy women is that they have different levels of this testosterone hormone, specifically free testosterone. Now, why do PCOS patients have a higher level, significantly elevated levels of free testosterone is due to the primary cause of this PCOS, this condition where there is a presence of abnormal testicular ovarian tissue fused together within these ovaries that can only be diagnosed via laparoscopy and treated via laparoscopy. Now, these tissues, they have a function of secreting high levels of testosterone within these women, and over time they develop male characteristics, male sexual behaviors as well, which means, for example, the common symptoms that we see with PCOS is excessive body hair, a lot of acne on the face and body, which is all caused by testosterone. If you see somebody who has a lot of acne, whether on the face or body, it's usually due to they having high levels of testosterone than those that do not have it. Furthermore, another important behavioral symptom is that they have an increased sex drive, increased irritability, mood swing. All of this can be linked to testosterone as well. They are much more easily agitated, much more confrontational. It's due to a hormonal imbalance between these women who have this PCOS. So why do they have an increased sex drive? Now, the process is very simple to understand. So to have a biological response or activity, which is in this case higher sex drive, there needs to be a receptor binding with these hormones. Now, since I already discussed that these women have higher free testosterone in their bodies because of an abnormal tissue caused by PCOS within these ovaries. So they have high levels of testosterone in their blood, but that is not enough. They need to have another component, which means they have these receptors that bind specifically with this testosterone. With both components, when they bind together, then a response is generated, a biological activity that can be observed. So women who have PCOS and those who are healthy have same numbers of these receptors. There's no difference in the number of receptors, whether they have abnormally high, there's no difference. The only difference is that they have higher levels of these hormones, which means most of the time these receptors will be binded or will be bound by these testosterone, leading to these aggressive behavior and higher sex drive. For men, we have a significantly higher amount of these receptors and hormone levels. We have both, which are significantly elevated compared to women. However, for women, they have far less receptors compared to their male counterparts, and also the distribution of these receptors are different as well. However, for those who have PCOS, they have normal levels of receptors, but significantly higher levels of this free testosterone that is causing these types of symptoms. So many of these patients, when they go for their treatment, they will be prescribed, the common ones are diagnosing and other types of contraceptive medication, just to ease these symptoms. It doesn't do anything to actually treat the underlying cause, to solve the high testosterone problem. So these temporary treatments are simply where they compete with the testosterone in the free testosterone from binding with these receptors. So these, when you take these medications, they are also hormonal medications, and they will take up the space of the receptors so that testosterone cannot bind with it, and then you will actually observe the symptoms reducing. You will see acne going away, the mood swings, the sexual desire, the acne, the body hair, all will slowly dissipate because these receptors are being taken up by this medication that you are taking, this hormonal medication that you're taking, but still it's not dealing with the underlying cause. That's why at Antai Hospital, if you really want to actually treat it permanently, effectively, without any dependence on medication, we offer you a laparoscopic surgery where we remove the root cause, which is this abnormal tissue within the ovaries. Now we use a highly specialized technique known as 3D laparoscopy, so that we will go in, expertly pinpoint the locations of these abnormal tissue, and we will only remove the abnormal tissue so that we can retain as much possible of the ovarian tissue and then retain its function as well. And upon recovery, you will observe that you do not need medication anymore. You will see that your quality of life improves a lot, mood swings are stable now, and your sexual desire will reduce with your physical symptoms slowly dissipating. And this is definitely something that you should be considering compared to those temporary interventions, because those are lifelong dependence that you need, compared to something that you can do for just one time and you can enjoy the effective treatment outcome. Furthermore, if you do not go for surgical treatment, you eventually will lead to another problem, which is you won't be able to get pregnant, or you will be having recurrent miscarriage. So the sooner you find out that you do have PCOS, the sooner you should take this treatment so that you can enjoy both benefits of having a high quality life and also a healthy pregnancy eventually down along the line. So I hope I've answered this question, explained it clear enough. And if you'd like to seek this treatment or a consultation with our doctors here, please visit the website. Let's set up a consultation and let's discuss how we can help you on your journey on overcoming PCOS and also achieving a healthy pregnancy.